Good evening, everyone. Thank you so much for joining us this evening, and I apologize for our late start. We had a few technical difficulties this evening, so I hope that the community is able to join us and listen in. And I would like to call to order the August 18th special meeting of the Croton-Harmon Board of Education. Recommended action that the Board of Education approves the agenda as presented. All in favor? Aye. Oppose? Abstain? Motion carries. All right, we will start off our meeting this evening to hear a universal pre-K update with Karen Gatto, our Director of People Personnel. So I will turn it over to Dr. O'Connell and Karen Gatto. Thank you.
Thank you. Okay, so thank you so much for making time for me to share.
Thank you. I'm just going to toss it over to Karen Gatto, and thank you very much for being with us this evening, Karen.
Okay, thank you. Thank you for giving me a few minutes to provide an update to the board and the community. I'd like to speak about the Universal Preschool program that we will be implementing this year. I think you've heard previously about some of the grant money that we received from the state, and the Office of Early Learning, New York State Office of Early Learning, did give Croton-Harmon $194,400 to use toward creating a pre-K program. And so the process is well defined by the allocation that's been provided to the district. The application just became available very recently. So while we received the allocation, we didn't really receive the ability to apply formally for it until very recently. The state has been running a little behind. However, we've been moving along the whole time in making some plans, and part of the, the money came with a number of mandates. So the money is for an extension program, and it's for 4-year-olds, kids who are 4 years old by December 1st. Full day program, 5 hours per day, 180 days a year, and we need to partner with another agency, a local agency. And so the district put out the request for an RFP, request for proposal, and Happy Hearts from Croton has submitted their proposal, and we have accepted the proposal. And so now we're in the phase of creating the contract. We are working with our school attorneys in order to complete that, completing the required application, and making all the arrangements to start the program. So now one of the requirements is that it is that we run a lottery. And so what you will be seeing in the very near future is our lottery that we will be holding. And so interested people who are interested in applying to this program will register, and we'll open it for a certain period of time. And then we will, then we will pull names from that lottery. Now we are allowed to have up to 36 seats. And so we go from there. If we have people who indicate an interest and meet all the criteria, then they will be part of the preschool full day program for 4-year-olds at no cost to them. It's not on an income basis, it's just part of the lottery. So if we have less than 36, for example, then all 36 would be admitted to the program. If we have more, then the lottery system will really kick in for that. And I'll keep you posted as we move along. You'll see some advertisement or promoting of the lottery. And this is all new for us. So I'm learning a lot as we go along, all of us are, and that we have a very eager partnership with Happy Hearts. The district will take on some oversight of this program. The district will include Happy Heart personnel and any PD that might be available, and we'll build this partnership as we go along. All right, any questions?
Mary?
Mary?
Let me see if I got all the technology right. Yes, thank you. Wow, that's really exciting. How many vendors, I was just curious, how many vendors responded to the RFP?
With written response, only one. What I had done at the very, on the onset of receiving our allocation, I had reached out to a number of local preschool programs and daycare to tell them that this would be coming. This would be forthcoming. And there were a number of people who were very interested, but when it all boiled down to submitting a written response, Happy Hearts was the only agency.
Okay, thank you. And where is this program housed? It's at Happy Hearts or it's in our district buildings?
Happy Hearts is right on Main Street.
Yeah, sorry, the program would be in their facility. Is that correct? I just didn't understand.
They have a couple of sites and they're expanding. So they already have the classroom space. They have a designated teacher. They've been working on the curriculum. Some of the grant money will go towards some materials. And the state is very, very clear about what the curriculum has to include and, you know, very detailed. So it's very helpful.
And then you mentioned this is grant funded. Is the expectation that it would continue year over year?
Yes.
Oh.
Yes. In fact, many districts already receive money for this kind of program or similar. There are different kinds of preschool allocations. Ours is called the expansion grant. So it's very specific criteria attached to that. And we've never had an allocation previously, so it's brand new for us.
So the expectation would be there'd be funding next year also from
yes, that's
from a grant. Okay.
Clear message attached to this. You know, we know, and our CET folks, Carrie, I see Carrie on the screen, can attest to this. Our kindergartners who come in with some preschool background, of course, are at an advantage. And at the very beginning of this, I spoke with Carrie and she described that there is a certain percentage of kids who come in without that experience. So, you know, maybe this will help fill the gap.
Absolutely. Okay, thank you.
Well, thank you very much, Karen, for giving us an update on that. It's very exciting news to hear. For one, I'm very excited to have a pre-K program in the village. So yeah, we look forward to continuing to hear updates from you as this process moves along.
Excellent. Thank you.
Thank you, Karen.
All right, and now we will be moving on to our superintendent's report. So I will turn it over to Dr. O'Connell.
Well, thank you and good evening. Can everybody hear me? Okay, wonderful, wonderful. So good evening to the board and good evening to our viewing public. I thank you very much if you're joining in tonight. And I'd like to thank my colleagues for joining me. I have Karen Gatto, Kerry Bianchi, Michael Plotkin, Lauren Scollins, Laura Duback, and DJ Goldman from our team. Hopefully I didn't miss anyone else on the Zoom. And I thank them for being with us tonight. This certainly is a group effort. So for those of you who joined us last time the board convened, I did go through a summary of where we were in terms of our opening plans and the things we were thinking about at the time. And then as I said in my K-12 alert, I promised to come back with more details. So let's get started with those details, and I'll be asking my team to chime in throughout the presentation. So again, a little bit with history. New York State Department of Health, Howard Zucker, on August 5th, made a statement which told us, schools and school districts, that we were now reestablished as the controlling entity for schools, and that we should develop our opening plans using the CDC and the local departments of health. So that was news to us. We didn't expect that. We were told that we were going to be receiving, information from New York State, as we had in the previous year and subsequent to that. But that was news to us and districts across New York State. The CDC for prevention in K-12 schools shared a very important statement that we've kind of anchored our thinking on. Students benefit from in-person learning, and safely returning to in-person instruction in the fall of 2021 is a priority. And what really permeates that entire document is the one statement that says, Croton, basically Harmon needs to have a layered mitigation strategy built into the opening plan. And that is what we have done. And that is what you have and will see in our opening plans. Another important document that we have referenced is the American Academy of Pediatrics, AAP. Another important statement strongly advocates that all policy considerations for school plans should start with the goal of keeping students safe and physically present in school. So important guidance documents that we have been referencing. Well, Commissioner Rosa, New York State Education Department Commissioner Rosa, basically fired back to Howard Zucker to say, we really did, school districts, expect to see something come out of New York State DOH. In the absence of that, New York State Ed developed their own guide and sent that out to school districts on August 12th. So, to start off and to make sure that we are really clear, Croton Harmon will have a full in-person opening for all students on September 1st. So that's very important to just come right out in the gate with that statement. I alluded to that in my K-12 alert on August 6th, letting you know that we're excited to welcome back our students on September 1st. But I did share with the community at that point that we still wanted to have more guidance, and that we still needed to want to meet with our reentry task force, which we've done twice thus far. And again, that was just an alert to the community to let you know that we were gearing up for our opening plan. And just to reiterate, our administrative team planning has included, and you've heard us mention Dr. Meir, our district physician, constant communication with Dr. Meir. We are in constant communication with our regional partners in Westchester County. We have reviewed the New York State Education Department guidance. We've reconvened our reentry task force and reviewed the AAP guidance as well as the CDC guidance. So again, very important documents which have governed our work. And I heard it described when we hear layered mitigation strategies one day of like Swiss cheese. If you think of one piece of Swiss cheese with all the holes, you see it, you see there are holes. When you continue to put layer upon layer upon layer, because the holes are not all in sync, you see that it starts to close up the holes. And that is kind of the greatest visual I have had in my mind when I'm thinking about the CDC talking about layered mitigation strategies. And again, that's what we're going to see in our plan. Starting off with our mitigation strategies, we are going to continue to use the daily health screener for all students and staff. There's one for staff, there's one for students. As you know, the one for students is the one that uses LINQ, L-I-N-Q. We will continue to use the green slips. Green slips afford us the opportunity to move students in a very fluid manner. We will continue to assess that, especially we'll let a month of school go and reassess. The reason I say that is because in the guidance, it did say we didn't need to stress that. in our opening plans. However, through conversation as a team, we've decided to keep that in place. And again, we'll reassess and see if it's something we will continue. But I think if you stop and pause for a moment at just the whole idea of it, it is our hope that it is a pause, a moment in time each and every day that families assess the health and well-being of students and staff assess the health and well-being of themselves and take that moment to say, am I ready to go to school? Am I ready to go to work? Now, that's very important that you take that moment in time and that assessment, because in our reentry task force meeting yesterday, Lori Payne, Nurse Payne, reminded us that even well before COVID, we should not be coming to school or work if we are not well. And again, our nursing team reiterates that. And the daily health screener is a reminder of that. We are going to promote social distancing to the greatest extent possible to allow for full-time instruction and maximize the instructional experience for students. We anticipate a 3-foot distance between students in the classrooms, and we will continue to use seating charts. Seating charts are extremely important. Seating charts in the classroom, seating charts in the bus, just to give 2 examples, because that helps us with our contact tracing, as you heard us speak a lot about last year. The CDC is no longer recommending desk shields, so this year we will suspend them in classrooms. We'll suspend their use in classrooms. You will hear in this presentation and in our opening plans, we're going to continue to have the barriers in eating areas. Again, continuing with layered mitigation strategies, monitoring. You know, kudos to our faculty and staff and our nursing team. We're always looking at students. Are they their normal self? If, and assessing. Looking at students and staff. If they have COVID-like symptoms, they will be sent home. They will not be permitted to return to school without a negative test clearance or a note from a doctor with an alternate diagnosis. Again, continuing with layered mitigation strategies, reporting, contact tracing, and quarantining or isolation will continue as required by Westchester County Department of Health and our school district's physician, Dr. Meir. I'm going to pause there for a second. I know I have some COVID coordinators with me tonight. So Lauren Scollins, I'll ask if you would start. Could you just give us a brief review of the intense process that's involved with this contact tracing, reporting contact tracing, and quarantining, if you would?
Yeah, and it is a lot of work and a lot of paperwork and a lot of investigation. And I will start by saying we don't make the decision to quarantine. We report a case to the Department of Health along with people we've identified as contacts through our investigation, which involves interviews of the student or staff member who is COVID positive, the seating charts, understanding 6-foot distance versus 3-foot distance, interviewing other staff members who are in the room, ensuring we understand who was absent or present that day. And then we provide all of that information as well as that level of detail to the Department of Health. And then they are the ones who make the calls to decide contact tracing or quarantining. As COVID coordinator and our principals and our nurses, when we've identified someone that we feel the Department of Health may want to quarantine, we have, as we did last year, we will continue to this year, preemptively give that family or that staff member a heads up. So we'll make that phone call. We sent out emails, left voicemails if we couldn't reach families, to ensure that they are aware that they may be contacted should the Department of Health feel that their child needs to quarantine during this situation.
Thank you, Lauren. Is there anyone else in the COVID coordinator team that wanted to add anything that Lauren may not have shared?
She did an excellent job.
Wonderful. Okay, so continuing with that, We started this in mid-year. I believe last year, we're going to have the principals continue to report the number of COVID positive cases in their weekly letters. That really worked nicely last year, and we would like to continue that. A little bit more on quarantining. There have been some changes to the rules that we are following based on Westchester County Department of Health as well as the CDC. And they've learned a lot over time. Initially, when we first had, let's say, a COVID case, positive case in a cafeteria, let's say at the high school, they really required us to quarantine the entire cafeteria. What they've learned over time has greatly refined their work in quarantining. So if you look at this slide, it says in the K-12 indoor classroom setting, the definition of close contact excludes students who were within 3 to 6 feet of an infected student if both the infected student and the exposed students correctly and consistently wore well-fitted masks the entire time. So our COVID coordinators, as Lauren was sharing, will be in discussion with Westchester County Department of Health and going through all of this information. And again, we are not a quarantining body. We get involved with the process because we want to expedite the process. As you may recall from and had an experience last year with New York State DOH or Westchester DOH, it sometimes took some time to alert people. That's why we as the school, anything that is pertaining to us, we get involved working in collaboration with DOH so that we can expedite getting the information to families so that we can speed up the process of isolating a person should there be that need. But we are not a quarantining body. That is not in our purview as a school district. The DOH will say who needs to quarantine. According to the CDC, people who are fully vaccinated do not need to quarantine after contact with someone who had COVID-19 unless they have symptoms. So if they are asymptomatic, they don't need to quarantine. Fully vaccinated people, though, should get tested 3 to 5 days after their exposure, even if they don't have symptoms, and wear a mask indoors in public for 14 days following the exposure or until their test result is negative. So again, we see some changes coming out of DOH, but and again, to reiterate, it is the district that is working with the Department of Health. They are the health experts and professionals. Layered mitigation strategies. Throughout the CDC guidance, we hear a lot about hand washing and respiratory hygiene. We're going to continue our campaign, sending reminders to our students and staff. It's for all of us to be frequently washing our hands and to be following proper respiratory hygiene. We'll continue with having hand sanitizer stations in our buildings and keep them adequately supplied. I'm going to pause for a second and ask Michael Plotkin. Michael, could you share with us, for example, at the beginning of the year with our teachers, our staff, the review of our protocols? If you would just take a moment and share that, if you would.
So first off, the protocols, and good evening, everyone. Nice to see everyone. The protocols are reviewed with staff, and they'll be done so again this year, the first day, as we try to give teachers a very clear picture about not only what protocols they're going to have to follow, but also how they can help their students manage these protocols. So then on the first day of school for kids, obviously we're going to work with those students to help them refresh their memory about what protocols are in place. Those protocols are pretty simple. They start in the beginning of the day with our daily health screener. We want everyone to know about that. And then we have hand sanitizers all throughout the building, as well as hand washing signs. We have social distancing signs. Is there anything I'm forgetting? That's about it.
Thank you, Michael. Continuing with layered mitigation strategies. Sure.
For respiratory hygiene, could you just explain what that is?
Thank you. It's, if we look at respiratory hygiene, how are we coughing? Are we coughing into our hands? Are we coughing into elbow? Are we, if we did by accident cough into our hands, are we then going to wash our hands? And, things along those lines. Okay, I'm going to continue. Ventilation, a layered mitigation strategies. Again, you've heard us mention this last year. Croton Harmon has greatly benefited from our capital improvement work over the last few years. Our unit ventilators and air handlers, that serve our classroom and common spaces have been fitted with MERV 13 filters. Our buildings will have the next replacement of filters before the school year starts. We have HEPA filtration units for additional protection in our nurse's office, in our isolation rooms, and a few other designated areas. And thankful to Paul Gibbons, who provided information that the HVA system that we have in place is designed to provide 15 cubic feet per minute of fresh air for every person at full room capacity. And that translates to an average of 4 air exchanges per hour in the classroom, depending on room shape and ceiling height. The quantity of fresh air is even greater when systems run in an economizer mode, as temperatures permit, or if windows are open. So I'll pause here for a second on windows. It's very important that to note that our principals and assistant principals and building teams are continually monitoring that our windows are open, that air is coming in, that there is that exchange, and that is something that is ongoing in our buildings. Continuing with our mitigation monitoring. We will, over time, continue to assess holding our live in-person events. Parents, involving parents, audience members, or spectators. So, for example, this week at the Reentry Task Force meeting, I was asked a question. Do we believe we will have, let's say, our audience members present for, let's say, the fall theater or our musicals, etc. We were going to need to take this on a case-by-case basis, depending on when this occurs, when is the event, depending on the positivity rate at the time, depending upon what the information that we're receiving from our partners in the county, the DOH. So each event will need to be assessed on a case-by-case basis. We are going to continue to utilize our outdoor spaces as much as possible. And especially in keeping with the instructional goals of a lesson. Thirdly, on this slide, we have purchased a few more tents for each of the buildings to have on the outside. We are going to continue our cleaning protocols that we spoke about last year. Our Buildings and Grounds team has a very specific protocol for during the day, for at night, when we have a suspected or confirmed case of COVID, and they will continue to follow their protocols. Our COVID coordinators are going to continue to network with our county partners and other regional experts. Our COVID coordinators meet weekly with the regional safety team from BOCES. And the regional safety team run by Frank Guglieri, usually has somebody from a Department of Health. Usually it's the Putnam County Department of Health that provides someone to come to the meetings to assist our COVID coordinators with the things that they are grappling with. This next bullet talks about our collaboration with the Westchester County Department of Health in terms of our screening testing and our vaccinations. Now, if you recall last year, we did run a vaccination clinic here in Croton Harmon. And thank you to the team that worked with Westchester County, our team that worked with Westchester County to bring that here. We'll continue to speak with the county if they feel that this would be an area that it would serve us well to have it. We'll continue those conversations to see if we should have another clinic here at Croton Harmon. We are certainly open to it, and we will continue that dialogue with our county partners. I'm going to talk in a few minutes about the screening testing. As you know, last year, we ran our own screening testing program here in Croton Harmon. The state had provided us with, if you recall, the Binax Now antigen rapid test kits, and we ran our own clinics here from January through June. We are going to be part of a screening testing program this year, which I'm going to talk about in a minute, but it's going to be a little bit different than what we had last year. This question comes to me often in terms of mandating and making it mandatory for testing and vaccines. The only thing I can add to that question is we will continue to explore that with council as well as the New York State Department of Health. And certainly get back to our public should it change from a voluntary status. So speaking of our screening testing, that's my next slide set. Again, I will mention it is voluntary. And I'd like to give you some of the details that our partners from the county have shared with us. So first and foremost, the ELC Reopening Schools Award, ELC Epidemiology Laboratory Capacity Schools Award. And again, these slides came from our this week's meeting with DOH Westchester. New York State DOH received an allotment of money from the American Rescue Plan Act. Westchester County received that money to work specifically with K-12 schools to establish a screening testing program. They are, Westchester, offering a uniform testing package for all K-12 schools, and they have partnered with 3 vendors: the Miramis, Mount Sinai C19 Safety First, and Quadrant Biosciences. Districts can opt into the program, and we have opted into the program here in Croton Harmon. It's important to note there's no cost to the district, there's no cost to schools, and there's no cost for individuals for testing. And each school will appoint a liaison to coordinate the program with the Westchester County DOH as well as the vendor. And that would be our COVID coordinator team. So there's a COVID coordinator in each building. And then there's Mr. Griffiths, who's the COVID coordinator for the district. So a little bit more about this vendor and DOH. Excuse me. Westchester County Department of Health will pair us with a vendor. At first, I thought we were to figure out what vendor we wanted. So I was doing some research on the vendors, but then we were told, no, the Westchester DOH will appoint the vendor to the schools. And it really, after hearing about the vendors, it really didn't really matter which vendor, because there's a basic package to all of them. And I think it's important to note that this is a saliva-based PCR test kits. So that's already different from what we did last year. For those who are part of our testing program, that was a nasal swab. So this is a saliva-based PCR test kit. Last year we used a rapid test. This year it is the actual PCR test. DOH and the vendor will supply staff to help us coordinate the sample collection, transport the specimens to the lab, as well as take place and part in the result notification system. So delving a little bit more deeply, what does this testing look like? It starts out with something called gateway testing, where we have students, teachers, and staff, again, consent is required, to be a part of the gateway testing. It's as many as we can. And that's done. Their hope is, again, I can only think about what it looks like from their perspective with all of these school districts, but they're hoping to target the first week of school. And again, depending on the vendor, the sample collection could be done in school or at home. And again, that's vendor specific. So whatever vendor we get, they might say specimen collection takes place at home. So we would give out the specimen collector, people would do it at home and then bring it back. Or it's done on site, meaning here at school where the person gives the saliva sample here at their school. Okay, and it would be at their school. After the one-time gateway, then each week thereafter, it's 20% of the population. And we work with the vendor as to how to determine that. Again, this is very much vendor driven, whereas last year it was Croton Harmon driven. So we will follow the rules of the vendor in how they'd like us to collect samples and et cetera. What will happen with the 20% happens each week, and that will continue to about December when we stop and have winter break. The Department of Health at that time will reassess the testing program and will basically give us the information at that point on how we're going to move forward. Okay, so that's the detail on the testing piece. So we are going to be partnering with the county, just like we had with the vaccination clinic. Most likely the county will be giving us something for the board to approve so that they can come on the premises just like they did last time. I do not have it yet, so I don't have it yet for the board. I know last time it was at the last minute. We had to convene the board at the last minute, but I can appreciate that they're working with a lot of districts and trying to coordinate things. So I do not have it yet, but we'll bring it to the board when I do have that. Mask wearing. This is also the question. I was laughing. I was picking up my lunch today, and a few people stopped me and wanted to ask about what is the district's position on mask wearing. So I know I did mention it last week, but I want to mention it again. Again, we started with the CDC recommendation and looking at their statements discussed with Dr. Muir and our regional partners, county partners, et cetera. The statement from the CDC talks about, due to the circulating and highly contagious Delta variant, CDC recommends universal indoor masking for all, regardless of your vaccination status, not under age 2. Therefore, so I want to be clear, based on this guidance, everyone will be expected to wear face coverings indoors and on our buses. That's very important. I'm going to say it again. It is everyone, regardless of your vaccination status, will be expected to wear face coverings indoors and on our buses. Face coverings will not be required outdoors, outside of the building, but principal and teacher may decide, given the nature of the outdoor event, to actually have people wear face covering. So I want everybody to know that if a teacher, our students to know if a teacher or principal decides for an outdoor event that masks should be required, students are and staff will be wearing the mask. And that again is one of the very important layered mitigation strategies. Mask breaks. I'm going to pause for a second and see if our principals want to share some information about mask breaks from your perspective, from your building.
Sure. So like in the spring, we are going to encourage all mask breaks to take place outside. If the class is as a whole going to take a mask break and the weather is not severe, they would go outside, have their mask break. Sometimes that's attached to a snack time or a movement break for the younger kids. If in the event of severe or, really strong weather where it would impact the entire class going outside, teachers would then on a individual basis, as if a child needed a break, they could either go out into the hall and take a break or walk to the bathroom and take a break, but it would never be the whole class indoors taking a mask break at the same time. So all mask breaks would either be on a needs basis, individually separated from the group, or as a whole class outside when they're going outside and incorporating some kind of a brain break or snack.
Thank you. Any other principal want to share?
Yeah, I just want to shout out to our teachers because last year they did a great job at kind of infusing these mask breaks into the right place in the instructional model. So for instance, it was an everyday sight to see students sitting outside doing their independent reading, spaced out, and with their masks off, getting their mask break. And this way, when the class was ready to go back in, they put their mask back on and they were on to other adventures. Obviously, during lunch periods, the kids will also have a mask break as we, distance kids at that time and they consume food.
And at the high school, I could give a shout out to our students because they navigated mask breaks incredibly well last year. When they're in their classes, their masks are on the entire time, and they have the ability to take mask breaks because they can go outside during passing periods, during free periods, and during their lunchtime. So they have the ability to self-regulate developmentally, which is developmentally appropriate for them.
We certainly see the K-12 continuum there. Okay, visitors to the building. Let's continue on. We'll once again limit the number of visitors to our buildings. And any visitor coming to our building will continue to undergo our health screening process. So we're keeping that in place. Moving on to instruction. Students are expected to return to school for full-time in-person instruction 5 days a week. Each school is going to follow their normal schedule, and we will no longer have the hybrid schedule. So I'd like to focus on this next slide, as this is an area that I receive a lot of questions. As we look forward to full-time instruction, Croton Harmon will not offer a remote learning access this year unless, so let's look closely at the boxes that we have here. The district needs to close for a period of time. Again, all of this, always, anything we're saying is we're continually needing to monitor the status of the pandemic. So let me just put that out there. And of course, if the district needed to close for a period of time, we would have remote instruction. In the second box, let's say a school building needed to close for a period of time. We would have remote instruction for that school building. Let's say an entire class needed to close for a period of time. That entire class would have remote instruction. Now let's look closely at the two boxes on the bottom. Let's say New York State Department of Health or Westchester County Department of Health places a student or staff member in quarantine due to a COVID-19 exposure. Of course, documentation would be required, but we would allow remote instruction to occur. And then the last box says, let's say a student or staff has a positive case, is COVID positive, with a confirmed note from their doctor. Therefore, they would be able to remote in, live stream in. So let me go a little bit more deeply in the next slide. But again, the basic premise is schools are open. We're back to in-person instruction. So that's always needs to be the mindset, right? So remote instruction then would only be for very, very specific scenarios. So let me drill down a little more deeply. Should those specific criteria be met, just what I've shared right now in those boxes, students in grades 3 through 12, they would live stream into their classroom, as well as navigate Google Classroom. So I'm a student and I've just been placed on a quarantine list by New York State DOH, and I'm in grades 3 through 12, one of those grades. I'm going to live stream into my classroom. The second bullet, should the specific criteria be met, and what I mean by that are those boxes from the previous slide, and I'm a student in grade K1 or 2, I would interact with a dedicated teacher to engage in both synchronous and asynchronous learning opportunities. So if I'm a kindergartner, first grade, or second grade, and I'm on a quarantine list, or I'm COVID positive, whatever that case might be, I would be interacting with a dedicated professional. And Mrs. Bianchi and Mr. Campanera are working on identifying who that person would be. There would be touch points during the day where, let's say, a morning meeting, etc. And I'm going to pause there for a second because Ms. Bianchi could probably explain it much nicer than I could. So Ms. Bianchi.
Thank you, Dr. O'Connell. So what we plan right now is that based on the number of students in each of those grades, K1 and 2, that are in quarantine, our plan would be that whoever they are, whether it's a mix of K1 and 2, that all those students would log on first thing in the morning with this designated teacher and do about a 20-minute morning opening, morning meeting, morning greeting. And then we would allot approximately an hour and a half of synchronous instruction per grade level. So anyone in kindergarten that was in quarantine would spend approximately an hour and a half with this teacher. And then they would log off for the day and be given, whether it's Seesaw assignments or Google Classroom, depending on the grade assignments, and they would work at their own pace and at their own rate on assignments that were given by the teacher. Then first grade would have about an hour and a half of live instruction, and then second grade would have about an hour and a half of live instruction. Then that whole group, whether it's a mixed age group, mixed grades, would come together at the end of the day for about 20 minutes, clarifying questions, check in, wrap up of the day, and saying goodbye and making sure that everyone is set and prepared for the next day's instruction. That's what we envision.
Thank you, Ms. Bianchi. Now, it's very important. One of the things you shared was, again, we're going to have to continue to monitor, right? So, what are our numbers, and are we able to handle that number with this model? And that's something we're going to always need to continue to assess. Again, building administrators will coordinate the remote access within 24 hours of notification. So we find out somebody is quarantined, the COVID coordinator and the building administrator will coordinate when that student would then Zoom into the classroom, et cetera, and articulate and figure the specifics out. But we do need a little bit of time in order for that to occur. Continuing on a little bit more and driving it a little bit more deeply, medically fragile students. Now, this is nothing new. So I want to make sure I'm clear on that, because Each year, there are students that for one reason or another are unable to attend school due to a medical condition. So if a student is unable to attend school due to a serious medical condition, which of course is supported by a doctor's note, as is our practice now, each family would meet with a team, the nurse, the principal, the counselor, to develop a medical plan to address the student's academic needs. It's important to note that that plan is not going to include them live streaming into the classrooms like on a day-to-day basis. They're Croton-Harmon classrooms, but the team develops a plan. So I'm going to pause for a minute and ask Mrs. Duback. I know you're in the middle of, have done a few over time, and if you would describe that process to the board.
Sure. So as Dr. O'Connell mentioned, this is something that is a sort of tried and true practice for us. So we meet with the team to craft a medical plan for students who might need one. And that team will involve building administration, school counselor, the school nurse, special education teacher, and or school psychologist where applicable, the parent, and usually the student too, situation dependent. And so depending on the particular situation, we craft a personalized plan to meet the individual needs of the student. And we're looking at what the condition is, what the doctor's recommendations are, what resources we have available, and what the potential length of time that the student might not be in person for. So for example, a student who might have a surgery where they can't attend classes for a month might have a plan that looks like tutoring by either a tutoring service or a high school teacher, and following along with the coursework of their regular Croton-Harmon High School classes. A student who might have an issue where they may not be able to attend classes for a longer period of time, we might look at different options. So we often partner with BOCES and use some of their online coursework through Edgenuity and more recently EduSeer to provide full online coursework. And then we usually follow that up with tutoring and check-in support with one of our teachers. So the plan is really individual and it's fluid, and we meet throughout the process to check in on progress, to work with the family to make any changes to the plan.
Thank you. So that was a high school example, but just so the board and the public knows that it is K-12 and it's the same approach, and the resources might be different, but it's the same approach. Going on to child nutrition, the federal government has extended the free lunch and breakfast program this year, as it had last year. Again, though, if you believe your household does qualify for free and reduced lunch, regardless of this federal waiver, you still need to complete the application. Our menus will be on our website for nutritious meals to choose from. Will implement the touchless point of sale software for all transactions. Cafeterias will have reduced seating capacity to allow for distancing. And that distancing will also be in place for our service lines. There will be signage and prompts so that we can guide students through the line and try to keep as much distance as possible. Weather permitting, we'll continue to use our outdoor spaces. And emphasis will be placed again on the repeated sanitation of our tables, chairs, and high-touch surfaces. Again, as we mentioned earlier, our plan is to continue using our physical barriers to the greatest extent possible in our cafeteria settings. Now, I always love this slide because I think our high school students will be very happy with this slide. High school students will be permitted to leave the campus during their lunch and free periods. So for a moment, we're going to talk about lunch at the three schools. So since this is a high school slide, I'm going to start with Mrs. Dubak. Again, we mentioned that students can leave the campus, but there are many students that stay on the campus. So Mrs. Dubak, would you just share a little bit about what it looks like inside, if students are inside, and the food lines and et cetera?
Sure. So we have I'd say 2.5 indoor eating spaces. We have our cafeteria, we have our rotunda, and then we have our main hallway benches where students spread out and can eat lunch inside. And then outside, we have multiple tents and picnic tables, and we ordered a number of new picnic tables for outside last spring. So our students really spread out over the whole campus eating. And I think they did most of them ended up eating outside by the time spring came around, because we have ample space on the campus. They'll often walk the track after they're done eating. And with them being allowed to go into town for lunch now, this also creates even more space for us, because even though students will go and get lunch, they'll often come back and eat it on the front lawn or under one of the tents. So we're really excited to have that open to them again. And for those students who do eat lunch in the cafeteria, we set up our line so that students can space out, and it mills out of the cafeteria into the main hallway so that they're not all bunched up in front of the service line. So we think we're a pretty well-oiled machine with lunch now.
Thank you. Now, the next slide talks about lunch at CET and PVC. I think you can see here at CET, the use of the multi-purpose room and other designated areas. Again, students will be 6 feet apart with dividers. And very exciting, this next bullet for CET, and then I'm going to toss it over back to Mrs. Bianchi. Weather permitting, an outdoor picnic option will be available. So Ms. Bianchi, would you like to talk more about lunch at CET?
Absolutely. And I love how it's that picnic option, because kids love when they hear the word picnic. I'm actually going to back up a little bit. And just as a reminder, last year we had 2 different scenarios for lunch. So for the first half of the year, kids because they were in cohort groups, they were eating in the classrooms at 6 feet apart. We were not using our multi-purpose room for cafeteria purposes at all. Then when we moved to the 3 feet in April and we put our cohorts together, you may recall that we started utilizing the gymnasium, both sides, and the multi-purpose room to successfully spread our children out at 6 feet and give them ample places to eat. Our PE teachers were remarkable last year in their sacrifice of the gym. I mean, they were so creative and so innovative in the way they still had PE classes. But I will admit that as a leader in the building, it was a hardship for me to see our PE teachers and our students not have that experience the way it should have been. So we are thrilled to announce that with the regaining of our entire multi-purpose room and the use of other designated areas up and around the multi-purpose room, we are able to redesignate our gym as a gymnasium and still maintain 6 feet of distance for lunches with barriers. So our multi-purpose room at full capacity can seat up to 90 students at 6 feet with barriers. Our additional spaces can seat up to 54 additional students at 6 feet with barriers, and that's all indoor. Then, as Dr. O'Connell indicated, we have our picnic option outside. We will be utilizing the Monet Garden. And for those of you who are familiar with CET, as you're headed up the ramp toward the multi-purpose room, there's a door on the left-hand side midway up that hallway that exits into the Monet Garden. There is also another exit to Monet Garden off the multi-purpose room. So our plan is that students who choose to bring lunch from home and choose to eat outside will be dropped off at that exit that's in the hallway on the way up to the multi-purpose room. to a supervised area where they would be encouraged to bring a beach towel or some kind of a small blanket and sit and have their picnic lunch 6 feet apart outside. Those students who are buying lunch will continue up to the multi-purpose room and go through the food service line, continue right down that path out the side door of the multi-purpose room, and be directed to a supervised area in the Monet Garden where they can sit in their with their blanket or their towel and have their food service lunch, what they have purchased from the food service line, outside at 6 feet. What I will say is we do not have ample tenting area out there at this time because we need to follow the regulations for having tents near the building. So I will say that that area will be untented. However, it will be supervised. Students will be 6 feet apart and they will have their picnic type lunch on the grass in the Monet Garden.
Thank you, Ms. Bianchi. And Mr. Plotkin, would you like to share about our PVC lunch experience?
Sure, and I'll avoid any redundancy. Basically, the kids come through the cafeteria. What's the most important thing about the transition from classroom to lunchroom is that we have our lunch aids monitoring so we can, again, uphold the trinity of our protocols, including mask wearing until you get your food and sit down, encouraging the kids to hand wash and use hand sanitizer, and of course, social distancing. So the kids will come into the cafeteria, they will go on the line, there will be 6 feet of space between them, they will get their lunch, and then we direct them outdoors. Outdoors, we have multiple picnic tables, a tent, and we have more picnic tables on order, so we're going to increase the capacity to eat outside. Last year, what we found is that kids found, spots in the shade on the hill to eat, and they did just fine with that. And what's also important to this conversation is the fact that we do a brisk cleaning between groups. And that's really important. So we will have the cafeteria, an alternative space, another large room, as well as the classrooms, if need be, to facilitate lunch in the safest way possible. And just like the other schools, we have partitions in our cafeteria tables as well.
Thank you very much. Transportation, Mr. Bernardi has been very busy with his transportation team. Again, students, drivers, monitors will be required to wear masks prior to boarding the bus, regardless of vaccination status. Buses will be loaded back to front with distancing between students. Students will have assigned seating. Again, we mentioned that earlier. Very important that we know where everybody is. And siblings will sit together to increase capacity on a bus. Weather permitting, our drivers last year would open up the top hatches, open up the windows to keep that air moving. They have a very, very specific protocol of pre and post trip inspections, cleaning those high use areas, steering wheel, handles, seat backs. And again, as mentioned, a log will be kept so we know who's seated where for contact tracing purposes. Get a lot of questions about band and chorus. Our band and chorus programs will certainly continue in person, 6 foot spacing between students. To the greatest extent possible, classes will practice outside. Again, when we talk about band and chorus, we're talking about activities that have a lot of air exchange. So we want to keep that a maximum distance as much as possible. They will be wearing masks while they're singing and playing their instruments. And I don't know if you got to see this last year, but even the wind instruments have specific PPE that goes on them, which aids in, another layered mitigation strategy. Again, when it comes to performances, as I mentioned before, last year we had wonderful outdoor performances. But again, as I mentioned earlier, everything will need to be on a case-by-case basis, depending on what's the status of the pandemic, what's the status of the positivity rate, and we'll make decisions accordingly. We so hope that we will be seeing our performances as we've done in the past. Athletics and other extracurriculars. I don't know if you've been following in the journal news lately. The last 2 days, I believe, there's been a lot of active articles addressing this. We do anticipate activities will return in person for the 21-22 school year. I did have to put that however there, though. However, there's still ongoing discussions in the region. So I know I have Mr. Goldman here, our Director of Health, Wellness, Physical Education, and Athletics. DJ, do you want to share a little bit about the meetings that you're going to be having? One I know tomorrow, I believe, and just share a little bit from your perspective.
Yes, thank you, Dr. O'Connell. So as Dr. O'Connell said, I do have a meeting scheduled tomorrow morning at 11 a.m. With other Conference 3 schools. Conference 3 is the part of Section 1 athletics with other small schools. So that meeting is scheduled for tomorrow at 11 a.m. Earlier today, the Section 1 Office of Interscholastic Athletics held an executive committee meeting. So it's anticipated that a lot of the information from that executive committee meeting earlier today will be shared with my colleagues and fellow athletic directors. So as Dr. O'Connell said, I have been actively collecting information from some of our neighbor schools to find out what they're doing. And then in conjunction with the information that's released from Section 1, I anticipate a communication going out to families of student athletes by the end of the week, so that when we're ready to start up our high school sports season on Monday, everybody knows exactly what is going to be expected.
Thank you, DJ. And I know we have already, regardless of who's going to give us whatever guidance, we know we have certain mitigation strategies already in place. Again, we'll have daily screening for athletes. Athletes will be bringing their own water bottles. If masking indoors, anything athletic that is taking place indoors, our athletes will be wearing masks. If they're going to the locker room, they will be wearing masks. They outdoors, that of course, you know, like we mentioned, would be optional, like it was last year. There's no preseason use of our lockers. And I know that you're developing a specific protocol for a lockers use after school, and that would be communicated to our athletes as well. So I know you've been very busy thinking through these protocols and, you know, et cetera. And now we await more information either from DOH, either from Section 1, et cetera. So DJ will be communicating directly with our teams as more information becomes available. The same thing goes for extracurriculars, although that's really not on the radar right now, you know, where folks are talking about that. But if anything should change or protocol need to be adjusted based on the type of extracurricular activity, the principal would be communicating that as well. Field trips. I don't have a slide on field trips, but that's a question that sometimes I get. Principals will be communicating with their teachers that just, you know, like we were doing at the end of last year, each field trip needs to be carefully reviewed to make sure and ensure we're following all safety protocols. It's something we should do, and et cetera. In terms of, I do get a question about overnight and exchange program. So I'm just going to make a broad statement, just like with a day field trip, we are going to need to carefully discuss and review any proposed trip. And it's going to depend on so many variables, but the greatest variable will be what is the status of the pandemic at that time. That, and I think enough said on that piece. Lockers, question that the students always had for me. At the middle school and high school, they will be issued lockers, so that will help them store their belongings. But they may not congregate, and that building leaders will work on, because we do not want anybody congregating, around their lockers for an extended period of time. Just like we did last year, it's very important for families to have an opportunity. Yes, they get the big picture of things here when they see the presentation, but it's very important for families to have connection with their building leaders. So you can see from this slide, the CET leadership team will have 2 meetings on the 24th and the 25th, PVC the 23rd and 25th, and CHHS the 24th and 25th. And you can see there's a morning meeting and an early evening meeting for each school. So we hope that helps people with their schedules. And again, the principals will be there to answer questions, to talk about the specific details of these plans and how it plays out in their schools. Again, remember we said we would assess each and every in-person event. So we're giving families advanced warning. Since our back to school nights occur in the fall, they will be virtual this year. And again, everything will be assessed on a case-by-case basis. My teachers asked if I could reduce using the word pivot. So I told them I would come up with a new word or words, changing course. That is, again, we always need to be ready and be on the ready to change course, depending upon how we need to respond to the pandemic. Above all of the above measures will be revisited periodically throughout the school year. We continually assess what's working, what needs to be tweaked, what needs to be fine-tuned. And again, we learn a great deal from our county partners, or if we're grappling with something, we discuss it with our county partners. We may need to make adjustments to this plan to respond to something related to the pandemic. Every teacher and our students will receive an electronic device. Dr. Blair will be communicating with families, just like we had last year, an electronic device. If internet is needed, we will work that out with families, but everybody will get a device, our students and our teachers. This is, just a brief chart that's in Dr. Blair's communication that's going to go out to families. Which gives very important information about what device, et cetera. You can see the device for kindergarten, the devices for grades 1 through 8, and then you see 9 through 12. They have the opportunity to get a district issued Chromebook or bring your own device. Again, this is a chart that I took from Dr. Blair's communication that will go out to families. This also is something I took from Dr. Blair and our Director of Technology and Innovations Communication. We will have, again, a pickup. We will have a central location to the pickup of the devices this year at PVC. And there are the designated times based on your letter of the alphabet. Again, this is in Dr. Blair's communication that will be sent out. And speaking of communications that will be sent out, we will be sending out a K-12 alert. It will have this plan included so that each family will have the specifics of what I've just been going and sharing this evening, as well as this PowerPoint presentation will be on the website. Again, it's my final slide. Based on the review of the guidance document, our consultations with Dr. Meir and our county partners, and our plan specifics, the Administrative Council is recommending a full opening of schools on September 1st, and using this plan that I've outlined for you with the help of my administrative colleagues this evening as our guide. And with that, my last slide says thank you. So if the board has any questions for me or our team, we'll certainly take them now.
Thank you for that. I know you had mentioned that almost 82% of our staff were vaccinated as of April. With the American Federation of Teachers and the National Education Association both signaling their support for vaccination mandates, what is the district's stance on requiring the vaccine from our teachers and staff?
So as I mentioned in one of my previous slides, in terms of mandating testing or vaccines, we'll continue to explore that with council. And I really would be very eager to see statements come out of New York State DOH, New York State, and or Westchester County Department of Health.
Sorry. Thank you, Dr. O'Connell. I just have one question. I know that right now, obviously, we are in very uncertain times with the Delta variant, but in trying to be hopeful and looking ahead to when conditions will improve throughout the year, ideally, I was just curious on your changing course slide, would that include revisiting, removing some of these mitigation strategies? If some criteria were to be met, such as infection rates going down to a certain level. And so I'm just wondering if there's been any discussion around that, as you've thought about these strategies with the, the Department of Health or the state or your regional local partners. And, I'm curious to know what that criteria might be and who sort of would govern that, I guess.
So thank you, Mary. I think we saw that kind of evolution last year, meaning where we had to go from, at some point in the year, we were fully remote, if you remember, even going back to March of 2020. And then we came back to school with a hybrid. Then we mid-year were able to bring everyone back. That I'll use the word evolution. And we base that on a lot of the state conversations on positivity rate at the time. Positivity rate, I would think, is going to be a huge factor in governing how we make decisions moving forward. But we'll never do that in the absence of our county partners, our district physician, Dr. Meir. At our last meeting, or maybe it was 2 meetings ago, Dr. Amler was kind enough to join us. Dr. Amler is the Westchester County Commissioner for the Department of Health. She really spoke to us at great length about the mitigation strategies that schools had in place and have in place, and being a real factor in why we were not seeing spread in schools. Again, her comment from last year, based on last year. So we would want to be very careful in examining those mitigation strategies and what we change. But certainly as an administrative team, we are open to that dialogue, always assessing and reassessing where we are, using data such as positivity rates and the expert information we receive from the Department of Health. But it's always our goal to try to pull back and bring school back to, quote unquote, what we remember to be pre-COVID. So I hope that answered your questions. Positivity rate is certainly going to be a factor. Conversations and guidance from the experts of Westchester County DOH, Dr. Amler, our regional safety partners, and Dr. Meir, really helping us guide those decisions. But the ultimate goal, Mary, would be that we wouldn't need any of these mitigation strategies, and it's business as usual.
Excellent. Thank you.
Just a few quick ones. The meeting with the building level, is that virtual or live? The CT, PVC, and the high school, the ones.
Sorry, I didn't know what you were referring to. I believe they're virtual, but I'll let my building leaders speak to that.
Yes, they're virtual.
Yes, mine is virtual as well.
Same at CET.
I'm sorry, did we hear them? You did. I'm sorry. I'm sorry, I couldn't hear. Could I have my building leaders repeat?
We all repeated that we're doing the meetings virtually. And I will just add that shortly after your communication goes out, Dr. O'Connell, we will be sending ours out with information about our particular options for those meetings and when they'll be held and the Zoom links attached. Looking forward to it.
Thank you so much for repeating that. I was having technical difficulties.
Then my next question is, the board often receives quite a few letters from the community around this topic, and I'm just wondering, and for the sake of getting their questions answered in the most expedited manner, would it be best for the community to reach out to the building administrators if they have specific questions about how the reopening plan, or should they set up an appointment with you or John? Like, where's the best? Because sending letters to us, the best we can do is really tell them to reach out to someone, but maybe we can cut out that middle step.
So that's a great question. Regardless of COVID, we always suggest that a family start out with their principal, their building level leaders, to keep it to the core and closest to the folks that could give you the most specific information. And when I say specific to your child, specific to the school they're in, specific to the class they're in, et cetera. So yes, the outreach should be to the building leaders, principal, assistant principal. It's a medical issue. Of course, the school nurse. I will tell you on occasion, I will receive an email that is asking medical questions. And therefore, I always will refer them to our stellar nursing team. So I think just a good rule of thumb is to go closest to the point you can go to get that specific information. Secondly, in each building, as I mentioned, are COVID coordinators. So if there's COVID coordinator, contact tracing questions, again, a building leader is there acting in that role. And on a district, the district COVID coordinator is Mr. Griffiths. So if there was something bigger than the school, but relative to COVID, again, we would like to, get families the information they are requesting to the greatest possibility that we can. So thank you, Iris, for bringing that up, because it's wonderful to start with your building leadership.
Oh,
Dr. O'Connell, can you all hear me?
A little louder.
Okay, I just wanted to ask, in continuing with the vaccination clinic that was held here this spring, the CDC did come out today and authorize a third booster shot. I wanted to know if you had any information or if you were considering at all affording that access, or if you could coordinate that for the people who were vaccinated in the district?
We are so open to having another clinic here. That would require us having our continued conversation with Westchester County DOH. When we reached out to them last year, they were fabulous. We certainly are eager to do that. It's just, I know there were some other priority areas, Mr. Griffiths is having conversation about the possibility of that occurring here. When we get information about, pardon me, a vaccination clinic, we will certainly put it out to the community. I was so impressed with our process with the clinic here. And again, it was the Pfizer, so it was the 2 times that we had the clinic run here in Croton Harmon High School. So we are eager to do so again. County Executive George Latimer is, again, a shout out to how supportive he has been to schools, and he has offered that, and we'll just continue to articulate that with the county on when that could be a possibility for Croton again.
Hi, and I just have one last question, and I just want to, on the slide where you talked about the 5 instances where remote might be a possibility, the one, and just in particular, I looked at the one that said student and staff with a positive confirmed case of COVID, and I imagine that person might be sick, so their ability to remote in may be limited. Am I correct in assuming, which I hate assuming, but am I correct that under those circumstances, that person, because they would be sick, might have may not be remoting in, but would have a different, more like the medical plan that Laura Duback was talking about?
So the medical plan that's for medically fragile students. This would be in that box you're talking about, Iris, where it says student staff with a positive case. Of course, if you're sick, no one would be wanting to, if it's a teacher, to be conducting the Zoom, or if it was a student even coming to class. That would be a normal sick day or sick days. And if they felt unwell, of course, if it was for an extended period of time, the building leaders would be involved in seeing what was needed. But just like now, when students are sick for a few days, they get their work, etc. I'm going to pause and see, is there anything our building leaders would like to add to that based on your experience when students are out for just a few days?
If a student was out, go ahead, Laura, I'm sorry.
I just wanted to piggyback on the idea of taking a sick day, because that's something that our team, our RTI team, our nurses were really starting to see, that we had situations where people were sick and you would see them, students on the Zoom, looking like they were going to fall asleep. So I think that's really important to reiterate that because we have the ability to do it for those students who might be quarantined or sick, that doesn't mean that, they necessarily have to do that, and that we'll support them in doing makeup work if that's the better route for them, and just focusing on being well.
Thank you. Did that answer your question? Good. Again, it's an opportunity, not necessarily have to. Mm-hmm.
All right, did anyone else have any other questions for Dr. O'Connell? All right, now Dr. O'Connell, I believe from a board perspective, what you are looking from us is a show of support for this plan going forward.
Correct.
So if I could just get a gauge of support from the board, so we'll do a thumbs up, thumbs down, so we can give that to the administrators. Can I get a show of thumbs? Thumbs up. All right.
Great.
That is all of us.
Well, thank you to the Board of Education. Thank you to our administrative team who has spent hours poring over data and our opening plans. And thank you to the viewing public. for your support and for chiming in this evening to hear this very important information. As I mentioned, a K-12 alert will go out this evening, and it will have the plan in a text form. And then I believe also this evening we'll be placing the PowerPoint on the website for you. And as you heard from Mr. Plotkin, as soon as mine goes out, then you'll get some building specific information about meetings. So that concludes my opening report. And once again, Board of Education, thank you very much for the additional meetings that I've asked of you. I still might be, and just wanted to fit that in there quickly. And again, for your continued support of our work here in Croton.
Well, thank you very much, Dr. O'Connell, and thank you to all of our administrators who joined us this evening to provide this information for us. It was incredibly helpful, and I know incredibly helpful for the community to be able to hear all of this. So thank you very much for that. And with that, recommended action that the Board of Education adjourn the meeting at 7:42 p.m. So, Anna moves, Omar seconds. All in favor? Aye. Aye. Oppose? Abstain? Motion carried. Thank you very much, everyone. Have a wonderful evening.
Good night, everyone.